Dr. Greenfield, welcome. How's it going today?
It's going well. We're doing well against the COVID virus.
Keep fighting the good fight. So for all of the folks that are listening in today, what Meddkit has been doing is we've been interviewing private healthcare practices because of COVID. And one of the big solutions to the big problem that we face in healthcare right now is in delivering highly personal, highly private care at scale. And Dr. Greenfield here, he is the epitome of that. He founded Cornerstone Rural Health Center, where he's currently the chief medical director. He's worked with many healthcare organizations, St. Luke's, Blue Mountain Healthcare. He's been an ER physician, a family doctor. He's hiked Everest. He's helped a nonprofit, Care Highway International. He devotes a lot of resources and time to. And he goes to Kenya every now and then to help children out with education. So, Dr. Greenfield, we know you're busy. Thank you for joining us today. And why don't we go ahead and get started by just tell everyone who's listening in what Cornerstone Health Center, what your rural health center does, and the patient population that you serve.
Well, Cornerstone is a rural health center, and what that means is that we take care of a lot of indigent patients or people that don't have commercial insurances. The reimbursements isn't always the best, and it's hard for physicians and healthcare systems to stay in business with the lower reimbursement. We're in an area where it's underserved, meaning there's not enough physicians, and there are not enough people that actually have health insurance. As a result, the federal government has designated this particular area as medically underserved or medically short in a population that cannot afford to support a physician. So
I think you're like the only medical center within like a 100 mile radius of one of the few.
Well, there's another one. I mean, I helped some other organizations start some, okay? And so I did do that. But what makes us unique is we've incorporated psychiatry and we work with some drug addiction as well as social services and primary care. So we've put all that together in this place, which does make us unique, as very few places do that, whether they're a rural health or not. But as far as I know, one of the only one in the state that's still doing that. So that makes us pretty special.
Well, it's hard enough when patients don't have insurance, they don't have cards. It's hard enough to get to get groceries, let alone to their medical provider. So if they have all those things in one spot, it's a lot easier to get the whole patient treated. But
that's the idea.
Suppose a patient doesn't have a car, how do they get to you?
Well, we have our office is pretty close to the bus stop, which is very important. And there's also your local transits. A lot of them will help out with medical transportation when we need to do that. So you can give them a 24-hour notice. This patient needs to go from point A to point B, and they'll help with that. Or there's some state-funded, what they would say, vouchers for them, that they could use these vouchers to go from point A to point B sometimes also.
Got it. Cool. So what has changed since COVID? What have you guys been doing? And I know for some of the things, but I think a lot of the practices that are probably following and watching would be really sort of, Cornerstone's been on the leading edge of a lot of the things that have been happening since COVID with telehealth and whatnot. So why don't you tell everyone what's been going on?
Well, we've done a lot of things. First of all, we started doing some outside car physical exams. So when people are too nervous to come into the waiting room, or it's too populated with people, we let them come into our parking lot. We designate them to go to a particular spot, and we'll see them that way. We do that to keep them safe and also the waiting room safe. I mean, you have people that they may be on chemotherapy, or they may have bad lungs, or in a situation where they're just high risk. So that way it keeps them safe. The second thing is, if you have somebody you think they might have COVID, you do the same thing to keep everybody else in the office safe. Okay. And of course, you suit up with all the materials and things to keep viruses away from you, and we do that. And of course, we're cleaning like crazy. We're in our masks, which of course, since we're one-on-one, I don't need it right now. As I see, you don't have one on either, but so but we're alone right now, so that's okay. And those type of things, and we've done very well so far. We haven't had anybody in our office catch COVID from our office.
Wow.
And I was pretty amazed at that. I mean, I started this whole thing out saying, expect everybody to get sick here. Nobody has. And that means we're doing a good job because we've treated a lot of COVID patients. We've got a lot of positive COVIDs. So that's one thing we're doing. Another thing we did is this area was not testing for the IgG or the virus itself for a while. So we connected up, and we found that Quest had a test that could that was stable and a good test to determine whether or not you had immunity or you had been infected or those types of things with COVID. So we started doing that test with Quest, and we started doing that in this area probably a good 2 to 3 weeks before any of the larger organizations even moved into the area to start to do it. And we've tested thousands of people, I believe, at this point. And I think that's helped out with a lot of numbers, got a lot of information in. And you are a big help with this, helping us with getting our website in line. We got a separate number out. We got that set up. People call that number in, and then we go on our website. They get the information they need to download to make an appointment. We bring them in and we test them. And we've been doing well with that. And I think it's a big help for the community too. So we're trying to ramp up and do that, and but it's still hard because people are afraid to come out, and nobody knows who's sick.
Yeah. Well, I mean, it's a challenging time for sure. I mean, we don't know how long this thing's going to be with us, but like looking at healthcare, if you're a private practitioner, you've got a private practice, you don't know what the future looks like. What advice would you give to other private practitioners, people that have a small practice? What do they need to be doing right now with COVID that maybe they are doing, maybe they aren't? What would you say the most underspoken or unspoken necessities are for private practice with COVID right now?
Well, I think the first thing is make sure you keep yourself and your staff safe. But secondly, don't be afraid. We're in healthcare for a reason. We're in healthcare because we're choosing to help people that need help with healthcare. It sounds really redundant and stupid to say that, but you don't have a fireman go to a fire without a hose. I mean, and so when there's a big event like this going on, you're going to send the firemen in with hoses, put out the fire. We have our testing. We can see who's got COVID. We have the protocols from the CDC and how we should be treating COVID, and we're staying open. We're not closing the fire station because it needs to be there and available for people. So first of all, don't be afraid. Secondly, if you're in private practice or you're thinking about starting private practice, remember there's something different with private practice as opposed to corporate-owned practices, which is you get to make your decision. When you have a patient that needs a particular variation in their help for the healthcare, you can do that. A lot of times in the corporate center, you can't because you are stuck to certain policies, procedures that they are allowed and they don't vary from. So what happens is we start to make cookie cutter healthcare as opposed to individual healthcare. And I know everybody's different with their healthcare. We're not all the same, and we all need different things. And it's important that we do that, and we can spend the time and we can actually provide the healthcare each individual person needs. And that's a big benefit I think your private people can do as opposed to your corporate owned people.
I think it's like key. I mean, what private practices have to go through is difficult right now. But what you said, like, there's so much more flexibility. You're able to really care for the person, spend a lot of time with the person, get to know the person, help the whole person, and not just, prescribe procedures, so to speak.
Right.
So there's a lot of flexibility, but there's also a lot of difficulty. And I think maybe some of our listeners may not understand what some of those difficulties are, some of the things you have to go through just to keep your doors open. What are those things, and what can people do to help?
First thing, we got to make sure we're getting reimbursed, which is difficult. And there's always a game with that. And no matter what, when you're an individual, it's harder to do that. So at some point, I am hoping that more and more physicians somehow get together as a independent, private type physician groups. You heard the IPA stuff. We do more and more of that so we can bargain as groups for these healthcare people, or do some kind of alternative in the future that will be a better option for people. And I don't know what that looks like, but it would be nice to, because our healthcare system doesn't allow us to provide the healthcare that we should. I mean, I get diabetics that actually can't get insulin crazy enough, or get delayed for a week or two with insulin, which doesn't make sense to me. And these are the type of silly things that go on so that somebody can save 50 cents or $1 here or there, and they can have more corporate dollars, which, I'm going to say myself, I'm a conservative person, but that's ridiculous to be doing that when you're coming to healthcare and necessities for people. And that doesn't make sense to me.
Well, and then
So,
oftentimes it's the physician that gets blamed when someone doesn't
yes.
have access to care, when some procedure just doesn't make sense because of economics. It's not the physician, like the farmer on the front line. It's not the farmer's fault that there's not enough food.
Right.
It's not the physician's fault that certain procedures. It's the bean counters. Okay, the
Yes,
bean counters
it's true.
hiding behind.
Well, there's so many times
and they're
that,
unfortunately making a lot of the calls. So like, I mean, I like what you say. Like, how do physicians get together? How does the public kind of take healthcare back, so to speak?
right. And that's going to be very difficult, because the problem is we as a group don't have the monetary basis to, I don't know, I want to say tongue in cheek, persuade people's values and opinions to help us in the right way. We don't have that kind of income. We don't have the money like the healthcare companies to incentivize people to help them. Did I say that politically correct? Yes.
Close enough.
And so with that in mind, we don't have that. And so when we have an insurance company that says to us, oh, we need this and certain paperwork done to give somebody their insulin, and we fill that paperwork out and we send it in, and then they tell the patient, oh, doctor didn't fill out the paperwork right. It's like, no, wait a second. I gave you a state-recognized prescription that states you need insulin. I can't help the insurance company saying you don't. Now, their doctor didn't see you, they didn't evaluate you, and they're making these decisions. And the reason why this is because they use a term called medical necessity, which is not medical necessity. When you look at the insurance's forms and you fill them out, they actually, and a lot of them, have a different term for medical necessity. It is as according to the insurance's guidelines, not what we think is medically necessary. So therefore, it confuses the patients, and they're allowed to do this, and it's a silly thing. And so then what happens? We fax the same paperwork over again. We fax it again. And after about the 8th or 9th time, they finally go, oh, I guess we finally got it. Now, this has been a week or two, and so now what has happened is the patient hasn't had their medication for a week or two, and so we have 360 million people in this country that have had no medication for 2 weeks during the year, and they can blame someone else for it. Look at all that money that those insurance companies just saved. That's billions of dollars. It's an amazing amount. And this is what it comes down to. That type of thing has to be brought out and taken out of the equation. And until that gets taken out of the equation, I don't see how it's going to change. And you have to deal with the politicians taken out of the equation also. But the problem is they're just as guilty if you want to go ahead. And I'm not saying this, I'm not pointing my fingers, but I wonder how much money the politicians get in donations from a lot of these insurance companies and their campaigns and other things. I don't know. And I could be 100% wrong. I'm not pointing fingers. I'm not saying anybody's bad, but I would guess there might be some of that going on too. So those things have to change. And who's going to change them? How are they going to change? Except if physicians do it independently together. I mean, we're not allowed to corporately bargain together. That was taken away in 1971 because they felt it was a national crisis if doctors together could have some type of a coalition and be able to collectively bargain against insurance companies. That's kind of weird.
Interesting.
Why not? Everybody else can do that, right? Whatever what the job is. I mean, you can have the teachers, the people who drive trucks, everybody else, they can collectively bargain, and they can
need to be able to.
Right, but we can't. That's a common thing that needs to be repealed, because the moment that gets repealed, then physicians can act independently, and then the corporate doesn't have control of us, who are also connected with the other corporates called the insurance companies, who are owning so many things, and they lose control, and boom, 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 it makes a big difference. And then in healthcare, we can start doing what is appropriate with healthcare as opposed to what's dictated in healthcare. And that's a totally different situation. But then again, we have to be responsible. We have to police ourselves. When you have those situations, you do have to police yourselves. I mean, how many times have we seen in so many different types of professions when there really are not other professions that could oversee them because they don't have the technical knowledge, the ability, the authority to do that, and that gets taken advantage of just because you're human beings. And doctors are human beings too, and there will be people that will take advantage of that. So we have to somehow police that or legislate that or watch that in a safe way that still allows us to appropriately treat patients. So this is a huge mess. I mean, it's just a huge mess. And I almost feel like you got to throw it out and start over again in some ways. And
well, there's certainly a lot of
clean the
talk
slate.
about that in among politicians. But I mean, I think you pointed out a couple of really interesting ideas, and like one of those things is like, okay, so physicians need to, and healthcare providers, not just physicians, but all healthcare providers need to have ownership of the system if they're the ones providing the care. I think that makes a lot of sense. And then checks and balances to make sure that the care is provided appropriately, cost effectively, et cetera. But like, what can patients, what can average people who are watching this do to help support private practice, to help kind of get personal care back in this country? I mean, a couple of things that I can think of, like certainly people, if you have a private practice nearby, show them some love, go to them.
Right, choose to go to them. Exactly.
And follow them on social media, like their posts, give them good ratings, push them up just as you would any other business. And then over time, people will start to get the message that care is really effective when it's delivered in a personal environment. And then some kind of maybe conglomeration can happen. But curious to hear your thoughts. What would you advise? What can the average listener, average person kind of watching this do to help?
Well, that's normally the case. It's competition. I mean, and choose to pick a healthcare place that's going to do that for you. And generally, I would tend to be private practice, and because the private practitioner can do what they would like to do, what they choose to do for the patient, as opposed to what corporate tells them to do. So that's the first thing. I know another thing that happened is, and I could be 100% incorrect on this, but when I first started in healthcare, every single hospital was required to have your administrator that was running it was a physician. That changed, and that changed legislatively. And so before you used to have a physician that was running the hospital had to at least be the administrator, so that if something wasn't quite right, that they knew both sides of it. Say, no, you can't do this to a patient. No, this is wrong to do. So they got rid of that person and replaced that with a bean counter instead. That's exactly what they did. And that's a huge change. Hospitals used to be a place that doctors got together to be able to put their patients in when they needed extra care. That's what happened. And then the insurance companies and then the bean counters took over and saw the monetary value that they could make from those systems, and they took them over. And then legislators helped make laws so they could take it over.
Well, and unfortunately, some of the problem might be some of this might be getting worse before it gets better, with all the consolidation, private equity buying ambulatory and family practices left and right now. So, this problem's likely going to get worse before hopefully average people kind of realize what's going on and really, again, support people that really care about delivering personal care, caring about the patient. So any final remarks? We're almost at time today.
We're almost at time. Well, one thing that makes us different is that when someone comes in and we need to address a emotional or spiritual need, we can also do that too. And a lot of times that's always frowned upon in the larger corporate systems, and it's important to address every part of the patient, especially if they're going through end-of-life issues. Yep. You need to address that so that they are not afraid, so that they still have what they have well. And what I mean by that is, my job as a physician, there's not one person that's not going to eventually die. It's impossible, including myself. But what is possible is trying to project and give hope to somebody that, hey, you know what? My life is worth it right now, and I can enjoy that. I can spend time with my family. I can go help someone else out, or I can go do something that I enjoy today, and I can do that. And to try to give that encouragement no matter where you are with your health care. And at the same time, give the best health care you can, and just try to make their life as comfortable as they can during that period of time.
And that's one of the things that's, I think, most sorely needed right now, especially. I think, treating the whole person is is a nice cliche, but when you actually get down to it, there's a lot that you do to do that, both in your office and out of the office. And I think that's really an inspiration to the model. So appreciate your time today.
Thank you.
We always love talking to you guys. And hopefully this video is helpful to someone on the line. And let us know your thoughts. And make sure you give Cornerstone Rural Health Center a like and a follow on Facebook. And share us your thoughts. Thanks, everyone.
Okay. Thank you.